everyone, it's Ivy. I'm here with Christy, one of my good friends and coworker, and I'm just going to do some teaching about fall risk assessments and preventing falls and fall-related injuries. So, in case you didn't know, most hospitals have a fall risk assessment in which they kind of rate the patient on a scale of low, moderate, or high fall risk. In this rating, they rate on a scale of 0 to 7 for each category. The categories include age, fall history, elimination assistance, the type of medications they're on, the patient equipment that they're connected to, such as IVs, SCDs, or anything that may be connected to them. Another thing that they consider is supervision for activity, so if they need assistance with getting out of bed, or if they need equipment to help get out of bed, if they have an unsteady gait, if they have any kind of visual or auditory impairment, if they have altered awareness about what's going on, if they're impulsive, obviously that's going to be a higher risk, and if they have a lack of understanding of what's going on with them and don't have a understanding of the immediate need of medical attention. So with this pointing system, once you get them rated on a low, moderate, or high, they offer interventions of what can be done, such as putting your bed low, having your bed alarms on, and I'm going to cover some more of that information here shortly. So the most basic thing that you can do is put a fall risk bracelet on a patient. So obviously if they're a moderate or high, you probably want to stick one of those bracelets on your patient. So that way anybody that comes in contact with your patient can easily identify that the patient has some kind of need of assistance as far as getting out of bed, or if they're a high risk of coming out of the bed without assistance. So that's the first line of defense. Next up, anytime that you get your patient out of bed, they offer gait belts. Are you familiar with gait belts?
Yes, kind of.
Okay, so with gait belts, it's pretty much just like a belt that you put on yourself. So once you put it around the patient, you just want to make sure that there's enough space to stick your hands in between the patient and the belt. It should fit snugly. So whenever you stick your bracelet on, or whenever you stick the belt on them, you stick your hands around their waistline, and that way you can have something to hold on to whenever you get your patient up. So this is great for ambulation or just transferring your patient from bed to wheelchair, etc. Alright. Next up, another basic thing are non-slip socks. So you're familiar with non-slip socks?
Absolutely.
Okay, so with non-slip socks, they just pretty much create a friction between the patient's foot and the floor. So that way, hypothetically speaking, they have regular socks on, they don't have shoes on, or they're walking barefooted. It kind of creates a higher risk of them slipping and creating a fall and potentially injuring them. So non-slip socks are great for that. So anytime your patient's out of the bed, you should probably have non-slip socks on them, if not good footwear. Another thing that's very obvious that most places have are fall signs. So usually outside the door they have some kind of sign that says that they're high fall risk, that you need to make sure your bed alarms are on, and also inside the room they have the whiteboards that identify if they're low, moderate, or high fall risk, as well as what type of assistance they need, what type of equipment they need to get out of bed, etc. And so with these, they alert anybody that's going into the room the needs of the patient. So that way people aren't just going in your room and saying, oh, hey, you need to go to the bathroom, let's just go. We can't really just do that because obviously if the needs of the patient are that they can't walk to the bathroom, or etc., then they won't be trying to get your patient up and hopefully preventing the fall that they could potentially have. Next, obviously, anytime that your patient's in the bed, you want to have the bed low. So with this, that's showing if they were to fall out of the bed, then it's it's a lesser distance than hypothetically saying that your bed was at a higher height. So if they were to fall from a higher height, obviously that it increases the risk of injury. So they can fall, break a hip, break a bone, have brain bleeds, all different types of things. So if you keep that bed low, closer to the ground, lesser chance of injury. Another good thing about having the bed low is whenever you get them out of the bed, they can firmly put their feet onto the ground. So when they put their feet on the ground, they're not having to leap out of the bed to get out. So yeah. Next, most hospital beds, all hospital beds, have bed rails. Most of them have 4 railings. So anytime the patient's in the bed, you want to have at least 2 to 3 railings up. So that way it prevents the risk of them exiting the bed on an area where they're not strongest at. So if they exit the bed on their weaker side, chances of them falling is much higher. Some hospitals offer 4 bed rails, but it depends on hospital policy, where some hospitals consider that a restraint. So you definitely want to look into that at your hospital just to make sure that that's not the case, because you don't want to get docked for having your patient restrained if they're not technically, restrained.
Right.
All right. Next are the fall mats. Fall mats, are you familiar with fall mats?
Yes.
Okay, so fall mats are just like this thin cushion that goes right next to the bed. And so with these, they help if the patient were to fall out of the bed, it kind of cushions their fall, kind of try to prevent injury. So with that, in combination with the low bed, should help prevent any kind of injuries with that. The only downfall about these are some people forget that you need to take the fall mats up whenever they get out of the bed, because having the fall mats on the ground poses a trip hazard, which could injure your patient.
Right.
Okay, so keep the bed low, fall mats down, pick them up whenever they get out of the bed. Next, anytime you have your patient in a chair or a hospital bed, you want to make sure that you have the bed wheels locked and the chair wheels locked. That way, if they get up or go back into it, the bed and the chair will not roll away and they won't fall on the ground. Okay. Next are the bed and chair alarms. So almost all hospitals have bed and chair alarms, and so with the beds, you can set it based off of the needs of your patient. So if you feel like your patient's a low fall risk, they're not very impulsive, and you don't think that they're really going to be getting out of the bed, or if they do get out of the bed that they're not too unsteady on their feet, you can have it on the lowest setting. And so the lowest setting will alert you whenever they stand up from the bed. So whenever the weight is eliminated from the bed, the alarm will go off. The moderate chair or bed alarm will sound once the patient is sitting up and moves to the edge of the bed. Once the weight shifts towards the edge of the bed, the alarm will go off. Now for your higher risk patients, such as patients that shouldn't be sitting up, they have some kind of injury that they shouldn't be sitting up, or if they're highly impulsive and they immediately just jump out of the bed, then you want the higher alarm. With that, as soon as they sit up from a laying down position, that alarm's going to go off. So another good thing with these bed alarms are the volume sensitivity. So the volumes can go high, medium, low. I always recommend having the high alarm on, so that way not only can you hear it, because obviously it's, with nurse-patient ratios, you can have 6 patients. If you have it on that lower setting, you might not hear it until you get out of another patient's room. At least with the higher setting, you can hear it. So it not only alerts you, but it alerts everybody around you that the patient is getting up, and they should not be. So with the chair alarms, the way that the chair alarms work it's just like a mat, and it connects to like a box. And some hospitals, they have a what we call a jumper cable, and it connects to the wall where the call bell is. So you put the mat down, you hit reset, sit your patient down, and you'll hear it beep about 3 times. And once it beeps, you know that the alarm is on. So anytime the patient stands up from that sitting position, the alarm's going to sound. And again, if you have that jumper cable, it's going to send the alert out into the hallway as well. So a good thing about the bed and chair alarms, they typically get sent to the portable phones that all the nurses have, as well as has the call bell that blinks red and it will not turn off until somebody goes into the room and physically turns off the alarm. So that's another good thing about that. Alrighty. How'd you feel about the education?
Great.
You feel
I feel like I'm ready to go.
You have a better understanding about everything going on?
Absolutely.
You feel comfortable doing everything?
Yes.
Okay, so maybe we can do like a more hands-on teaching so that way you can actually get in there and work with the actual alarms as well as the chair locks and everything, and you can assess your patient and see what type of needs they need.
Absolutely.
All right.
Thank you.
Thanks.